Dr. Trevor Dummer. I'm the national co-director alongside Philip. I've had the privilege of being part of CanPath from the very beginning. I was working with Atlantic Path and may have met one or two of you as you were recruited through the Halifax Shopping Centre. So I've been a part of CanPath in different guises since 2008. I moved to the University of British Columbia about 10 or 11 years ago, and I've worked with the BC Generations Project for a while, and have now transitioned into the more national role. And as you can see from, I guess, a really long job title that I've got, my interests are really in cancer prevention. So as Philip mentioned, he's a geneticist. And ac across our research teams, we have a wide range of different interests. And I'm a population health scientist, but I come at it from a much more social science view. So my training is actually in health geography. So I'm really interested in the environment and how that really impacts disease, and in particular how it impacts cancer, but how we can utilize that information for cancer prevention. And CanPath really is, um, if I can just, that's it, thank you. Moving along. So CanPath really does provide us with an opportunity to try to understand how the environment around us actually impacts our health, because it's really crucial. We all live, work and play in specific places, and places really do interact with behaviors, genetics, environmental exposures, all sorts of other things to actually impact our risk of cancer and other chronic disease. So as a geographer as well, we actually draw together information. That's why there's a picture of some map on here with lots of different layers of information. We use mapped data to compile different information layer upon layer to try to really understand the context of how and why diseases like cancer occur, but also then how do we use that information as a focus for cancer prevention? Because the old adage is quite true. Prevention is much, much better than cure. And the graph here along the bottom shows you that actually, cancer is a really quite preventable disease. Up to 40% of all cancers could be prevented if we can put into practice some of what we already know. But it does vary by different cancer types. So cervical cancer is virtually 100% preventable through vaccine, for example. Whereas we don't know that much about prostate cancer, so it's not a particularly preventable cancer. And there's lots of different ones in between. So what we're trying to do really with CanPath is to try to understand more about how um, how your information you gave us about your lifestyle, about your behaviors, about your occupation, about all these other things, how that might interact with your built and natural environment that surrounds you to give us some ideas about how we might be able to move forward to prevent cancer. So we set out, obviously, you completed detailed questionnaires, a baseline. Some of you did the follow-up. As Philip mentioned, we've had an occupational history questionnaire, the COVID questionnaire. This has captured lots of really useful information. And in terms of the environment, we asked you about your sun exposure, secondhand smoke. We also collected information on occupational exposures through an occupational history. So we got some information on your environmental exposures from you. We also got some information on your individual behaviors, like your diet, physical activity. We're going to be hearing more about occupation and also about diet a bit later on. Um, but as Jennifer said, one of the powers of CanPath is its ability to be able to link to other databases. So Jennifer talked about linking to health records and the CAIHI information to tell us about your health experiences, your encounters with the health system. But also because you gave us your address information and your postal code, we're actually able to use that to actually connect to a whole range of other databases that tell us about the environment around you. So that becomes really, really powerful. And that's the focus of my presentation. I do want to say with these types of linkages where we're using your postal code, we don't give the postal code out to researchers. Researchers don't know where you live. They don't have that level of information. What we do is take the postal code information, make those linkages to the environmental information. And then when we provide information to the researcher, they get obviously your questionnaire data, but they get the variables associated with those environmental exposures. So they don't know where you live. They don't know your home address, for example, because ensuring your privacy is crucial to what we do. So in terms of environmental linkages, we've partnered with a major group, the Canadian Urban Environmental Health Research Consortium, otherwise known as CANU, which is a nationally funded organization that has been collating a whole range of environmental data sets across Canada. And they've been using the postal code information that we have to link your participant information to these environmental databases. So I've just put a few examples on here. So, for example, air pollution. We know that air pollution, forest fires, but air pollution from vehicles and stuff is a serious health hazard. So we've been collecting information on, for example, fine particulate matter, PM 2.5. Now, these are this is smoke, but you can't see it. You can't see the particles. PM 2.5, it means they're less than 2.5 micrometers. So if you imagine a strand of hair, these are particles 30 times smaller than a strand of hair. So you can't see them. Issue with those is when you breathe them in, they go very, very deep into your lungs and they sit in there and they can cause inflammation and other health related problems. We've also got information, for example, on green space. So, are there parks? Are there lots of green spaces for physical activity in the neighborhood you live in, for example? We know that can impact health. In terms of other neighborhood factors, walkability. Do you live in an area where you can easily walk around? You can walk to work, um, you can walk to school, you can walk to the shops, or do you live in an environment where it's like if you want to go to the local shops, you have to drive? So walkability can be really important for physical activity. So Canoe have collated information on neighborhood factors, things like nighttime light. We know that light pollution at night can actually impact sleep patterns, which can also impact on health. Canoe have collected a whole range of other databases, and currently there's about 40 different data layers or data variables, databases, datasets connected to CanPath, available to researchers who want to explore the impact of the environment on people's health. So how are your data being used? So some of you may have seen this article in the journal Nature, or at least seen it on the news, because it actually did make international news and international news headlines. And Nature's probably the foremost scientific journal in the world. And they were looking at lung cancer in never smokers. So although we know that smoking is a major cause of lung cancer, about 30% of Canadians who develop lung cancer have actually never smoked. So there's something else going on. It's not just smoking. And this landmark paper identified that actually air pollution is possibly or quite probably driving some of this increased risk in lung cancer in never smokers. And the Cartagena or Quebec cohort contributed data is a significant landmark paper. So your data and CanPath data are being used to really contribute to some of these major questions that are being looked at in an international basis. As well, we're really keen to support training and CanPath data. We heard a little bit about the synthetic data set, but CanPath, your real data as well, is being used by a number of trainees as part of their training and to train, and we're supporting training the next generation of scientists. So Atul and Ezra here are two PhD students who work with me at the Cancer Prevention Research Excellence Cluster at the UBC. And they're using CanPath data as part of their doctoral research. And they also collaborated on a project using the BC Generations study, looking at cancer risk, obesity, and physical activity in relation to the built environment, so linked to some of those Canoe variables. So they looked at green space, and this is a map here of green space and sort of in the Victoria area or in Vancouver Island. So you can see the brown is less green space. The darker green is more green space. So you can see there's quite a lot of variation across that region. Walkability from the lighter color, least walkable, to the darker purple, most walkable. You can see that there's significant variation across Metro Vancouver in terms of walkability. They also looked at air pollution. This is NO2, not PM 2.5, but similarly NO2 is related to vehicles and cars. So you can see actually the darker the brown, the higher the pollution, and it's pretty concentrated along road networks. So this study looked at those factors and looking at how it impact obesity, physical activity, and walkability, and also cancer risks. So this bar chart just looks at the change in things like walking, MVPA, or moderate to vigorous physical activity. This would be something that gets you sweating and the sort of exercise that's really good for you, but also how it impacts obesity. This was a project led by a colleague, Dr. Lawrence Frank. And as you can see, there was a huge 176% increase in walking and a 78% increase in moderate to vigorous physical activity in areas that are the most walkable, whereas obesity was almost 40% decreased in areas that were most walkable. So you can see there's we're showing significant impacts on physical activity and obesity in relation to walkable neighborhoods. And what's really important is obesity is a major risk factor for a number of cancers. So we can identify areas, things in the built environment we could tweak and change that might actually reduce cancer risk. Now, this bladder cancer graph's a little bit complicated, um, but I mean, what I would say is, if you look at this, if the dot, which is the hazard ratio, if that dot is greater than one, there's an increased risk. If these sort of the bands with little sort of gray tails, if they don't cross one, then you would say that was statistically significant. I've just honed in here on the bladder cancer in relation to NO2 and what a tool found in the BC Generations project, where there was actually a significant increased risk of bladder cancer in relation to NO2 exposure. So overall, we could say that in relation to bladder cancer, we didn't find much in relation to greenness. The walkability was a little bit inconsistent. I didn't go into too much detail on that, but there was potential protective effects, but it was very difficult to untangle from the impact of other environmental exposures. But the NO2 did see a significant increase in the highest category of NO2 exposure, so a significant increase in bladder cancer. In terms of physical activity and obesity, it was pretty clear that a walkable neighborhood strongly impacts and increases physical activity in the participants, including vigorous exercise, but it also decreased overweight and obesity. Just want to finish off on focusing on some work that started in Atlantic Path, Atlantic Canada. And this was something that I was involved in from very early stages, and the Atlantic Path toenail collection part of our study. So all of you from Atlantic Path will know the Atlantic Path as the toenail study. We were the only regional cohort to actually collect toenails. What's really important or really useful about the toenails is once you clip them, they're about 8 to 12 months old. So things that accumulate in them, which includes environmental heavy metals, have been around for a long time. So that they are a really good measure of a long-term exposure. So really good indicator potentially of long-term risk, because we know that certain heavy metals, environmental heavy metals and other environmental contaminants such as arsenic do impact cancer. I would be remiss not to mention as well that this is the subject of the Guinness World Record for the largest toenail collection, and there's been lots and lots of research done in this area that's been published in a number of really major journals, Environment International, Science of the Total Environment, where we found some really novel things about arsenic in the toenails. I won't go into too much. I'm not going to go into detail about these papers, but if anyone's interested, you can get links to them at the Atlantic Path website. You can also get links to them on CanPath's website as well. But it's not just necessarily about looking at arsenic and toenails and other things. There's been lots and lots of research conducted. Some of this is in Atlantic Canada, some of this is in some of the other regional cohorts as well, looking at things like physical activity and walkability or diet quality in the neighborhood environment, how environmental factors impact sedentary behavior, chronic obstructive pulmonary disease, et cetera, et cetera. Again, not going to go into detail about these papers, just to show you that your research has your data has been used extensively in really high quality research that's contributing to a number of important areas. And these areas are all useful if we're looking at cancer prevention, because they're identifying environmental risk factors. Finally, just want to talk a little bit more about some of the more recent toenail research. So we had a study funded by Prostate Cancer Canada, led by a team at Dalhousie University, that was looking at the relationship between toenail arsenic and prostate cancer. And we've now expanded that to look at all cancers. So basically, you take the toenails, and probably one of the worst technician's jobs available is the technician has to open these little bags of thousands of little toenail clippings, put them into a device that can digest them and break them down into something that can then go into a vial, that can go into a machine that's pictured here, which can actually measure not just arsenic, but about 22 to 24 different environmental contaminants. And so we can actually build up a really detailed picture of the types of things you've been exposed to. And that's got real potential for cancer prevention because we can identify in the toenails potentially biomarkers that might be able to be linked some way to a cancer sometime in the future. Potentially, they could be a risk factor for the cancer. So if we can identify biomarkers in toenails of exposures or combinations of exposures that you have actually had, we might be able to identify people that will be ideal for early detection, for screening, or for preventative types of precision medicine. Um, and this is particularly exciting, this analysis, because it's using a branch of artificial intelligence called machine learning to really try and make sense of you've got a suite of 22 to 24 different environmental heavy metals. How do you try to understand how some of those might be contributing to something that's going to cause cancer somewhere down the line? So this is very exciting research.